Have you ever felt lonely in your life? Do you ever know how feeling lonely and experiencing this feeling of loneliness and social isolation tends to impact your health over a long term? In today's video, we will be discussing about loneliness and social isolation, and the structure of the video will be divided into 4 chapters. And first chapter would be introduction or definition of social isolation and loneliness, and second chapter would be the trends and the increasing trends of loneliness that we are observing worldwide across the globe, and the third chapter would be the health impacts of social isolation, how being lonely and not having proper social connections is impacting our health, and how it is increasing the mortality of the people across the world. And the fourth chapter will be how establishing good social connections will help in relieving a lot of chronic health diseases, be it related to physical health or mental. Let's start with our first chapter, which is the introduction and definition of social isolation. So what is social isolation? Social isolation is having few or no social relationships, no social roles, no group memberships, and infrequent social interactions. And loneliness is a subjective internal state. It is a distressing experience that results from perceived isolation or unmet need between an individual's preferred or actual experience. Being lonely is identified as one of the most common public health concerns these days. Although during ancient times, be it in the Chinese Taoist philosophy or the Greek philosophy times, people used to choose to be isolated in order to improve their wisdom or attain enlightenment with the universe. However, these days a lot of people are impacted with this loneliness, irrespective of their choice to be socially connected or socially isolated. Before lockdown, a lot of philosophers and researchers have already identified a growing disconnect among the people, which ultimately led to loneliness and social isolation. And the reason behind this growing disconnect between people is mostly due to the change in the trend of the lifestyle, people choosing to stay single and interacting more virtually, and people who are mostly living in nuclear families. Most of the people are migrating to different countries and so on. Social isolation and loneliness has to be addressed as a serious public health issue, the way we address other serious addictions such as smoking, substance abuse, or obesity, or any other public health concern. To understand more about how loneliness and social isolation are impacting the population around the world, let's look at the rate of increasing trends of loneliness and social population among various ages and various race and various geographic locations, and also how this rising trend of loneliness is impacting our health. This leads us to the chapter 2, which is the trends of loneliness and social isolation. 1/4 of adults of 65 age or older tend to report social isolation. This is a graph which shows that 1 in 4 young people in the world feels lonely. This is the data collected from 1,500,000 respondents above 15 years of age in around 142 countries and territories. Let's move on to chapter 3, in which we will address the health outcomes of being lonely, being socially isolated. There are plenty of health outcomes, and especially people who are often lonely and socially isolated are known to face premature death and also suffer from poor health conditions. First, let's look at the impact of loneliness on heart diseases. Data across 16 longitudinal studies shows poor social relationships were associated with 29% increased risk of heart disease and 32% of increased risk of stroke. Research has also found that children who tend to suffer with social isolation or extreme loneliness during their childhood years were known to develop all the kind of risk factors which will ultimately lead towards some form of heart disease in their adulthood. The risk factors for heart diseases can be like raised BP, hypertension, obesity, overweight, raised sugar levels, and so on. So, year 2022, the American Heart Association concluded that social isolation and loneliness are common yet under-recognized determinants of cardiovascular disease and brain health. Now let's look how this feeling of loneliness tend to be a precursor for type 2 diabetes mellitus. Social disconnection like having poor structural social support or lack of proper emotional support in women and living alone in men, and women who doesn't have a current partner who are over the age of 70 years all had or all have shown an increased risk of developing type 2 diabetes mellitus. With smaller social network size were known to develop this type 2 diabetes mellitus much earlier, and also people who already had this diabetes mellitus will tend to develop more complications if at all they had a lesser social connection. Now let's look how loneliness has an impact on developing infectious diseases. Generally, people who tend to have lesser social connections were known to more susceptible to all kinds of infections, and also they tend to display weaker immune responses. This is quite interesting study which was conducted among two different kind of participants. One group of participants had good amount of social connections, minimum 6 or more social ties, and the other group of participants had less than 3 or 4 social ties. So when these two different group of participants were exposed to common cold virus, and there was an interesting report which mentioned that people who had more than 6 social ties were less susceptible and did not even develop the common cold, whereas people with less than 3 social ties easily develop this common cold, which clearly displays that people who are poorly socially connected tend to be very weak and have a low immunity in them. Let's look into whether this loneliness and being socially isolated has any impact on our memory power. Unfortunately, chronic loneliness and social isolation is determined as one of the major risk factor to develop dementia in approximately 50% of older adults. There was this another study that has followed older adults for a period of over 12 years, and what they have observed is that there was a 20% reduction in cognitive abilities in patients in older people who have tend to be lonely most of the time. Now let's understand whether being lonely and socially isolated have any impact on development of or progression of psychological symptoms like depression and anxiety in older people, or even in children, or even in young adults. A systematic review which was done among older adults also found out that there were odds of developing depression in patients who tend to have reported loneliness, and the odds of developing this depression was nearly double in people who have reported loneliness. A review of 63 studies has concluded that loneliness and social isolation in children and adolescents tend to increase the risk of developing depression and anxiety in their adulthood. And also these symptoms tend to stay with them till 9 years or more than that. Social isolation is one of the strongest predictor of suicidal tendencies, as mentioned in a 2010 study done in Interpersonal Theory of Suicide. In a study conducted in 500,000 middle-aged adults, the probability of dying by suicide is more than doubled among men who normally tend to live alone. The same study showed that for women, loneliness was significantly associated with frequent hospitalization and also self-harm. Now let's dive into the fourth chapter, which is the final chapter, in which we will understand how having good social connections have a positive impact on our quality of life, be it in terms of having good physical health, good psychological and mental well-being, and having a proper emotional well-being. And not only that, having proper social connections is known to have a positive effect on our financial outcome also. Evidence has shown that Having proper social connections and strong connectivity among people will help in improving the health of our heart. In addition to that, social support and social bonding are known to regulate our neuroendocrine system in a positive way. There has been a lot of evidence which shows that people who have a greater purpose, a proper significant purpose, and also people who tend to have practical and emotional support, social support, are more likely to engage in health promoting behavior. So what is this health promoting behaviors? People who have proper social connection and who have support from their social networking groups, be it from direct social groups or indirect social groups, they tend to utilize the preventive healthcare services properly. Two different kinds of social connections which we all tend to have. One is like direct social connections, which are like our close people whom we tend to live with, and having healthy close relationships will help in improving our health outcomes, like finding one to sleep properly, sleep on time, and to take medications on time. It will help in improving the health outcome. Indirect social connections like peers and friends also can play a major role in our well-being. There is a high tendency of you to engage in any kind of physical activity, be it going to gym or running or walking or any sort of physical activity, if your friends are also pursuing that physical activity. And also there is a high chance of you to quit smoking or any kind of addictions if your friend group or peer group are also in the same path of quitting any kind of social addiction. Here is an interesting point. Having proper family connectedness and school connectedness among adolescent ages actually help in improving the educational outcome of a particular student. And also there are more chances of the student to complete a 4-year graduation program. For example, if you take into consideration why few medical students tend to drop out is mainly due to lack of proper social connection during their study period time. This was claimed as the major cause of medical students dropping out of their studies. Even in jobs, it was known that supportive and inclusive relationships at work tend to have a positive impact on the performance of the employee, be it in performing their job better or improving their creativity in their job, or job satisfaction or competence within the job. So all these factors will be improved when the employee is known to have a proper connection among their peer group. Regular communication among the co-workers is also highly important. It's very important for the co-workers to communicate and connect at all levels, not only within work but also in emotional ways, and connecting outside work also was proven to have a positive impact performance of the employees within an organization. And these kind of positive connectedness among the co-workers will help in reducing the burnout among the employees, and it will also help in relief of stress with high working hours and high impact stressful job.